The agenda for part 2 is going to be MIPS general financial risk, and then we will discuss payment adjustments, including the description and application of these payment adjustments. We will talk about the positive and negative implications of payment adjustments via the performance score. And finally, we're going to break it down into a case study example, and we're actually going to work through some numbers of physicians, what their actual reimbursement would look like. So for the MIPS general financial risk, the 2019 fiscal year is going to distribute something like this. The low performers are going to experience a 1 to 4% reduction in their Medicare reimbursement. The average performers are going to experience a 1 to 4% addition to their reimbursement, and the high performers are going to experience a 4% plus reimbursement to their Medicare payments. Maintaining budget neutrality is of utmost importance for this program, so the low performers are going to be giving to the high performers. So the point of showing you this bell curve is to re-emphasize the point that physicians' scores are compared against one another. There's only one pool of money. The funding is not coming from an external source, so it has to be a neutral change for Medicare. So that means that the high performers are going to be earning from the low performers. So for 2019, the adjustment is going to be between -4 and +4%. And then in 2020, that is going to increase to -5 to 5%. And then as you can see, 2021 and on, it's going to increase. This is going to continue, and it is subject to amendments based on the rules that CMS comes out with. So here's a look at the payment adjustments. We have max incentive and max penalty on the y-axis, and then we have your MIPS score on the x-axis. If you're in the penalty zone, that means you're below the CMS performance threshold with your MIPS points, and you're going to receive somewhere between the max penalty and 0 reimbursement. And then if you exceed the CMS performance threshold, you will receive a positive adjustment and be eligible for bonus points. Clinicians with a MIPS point score that is less than 25% of the performance threshold will automatically receive the maximum penalty. CMS has the discretion to set the performance and the exceptional performance bonus threshold scores to arbitrary values. For 2017, CMS set the performance threshold to a very, very low value of 3, so that avoiding the penalty is relatively easy. The flip side of that is they set the threshold for exceptional performance quite high to 70. Let's take a closer look at your MIPS score. How is it broken down? As we reviewed in part 1, we know that the composition of your MIPS score that's going to result in reimbursement in 2019 for the 2017 performance year is 15% clinical practice improvement, 25% advancing care information, 0% resource use or cost, and 60% quality. In the 2020 payment year, which will be next year, the 2018 performance year, you're going to see that the composite score distribution shifts. So now the main change is that we're going to have 10% of that score due to resource use or cost and 50% due to quality. We don't know exactly what the composite score distribution is going to be in 2021 and 2022, but we know that there will be an up to 7% and then up to 9% payment adjustment for those scores. We can predict that resource use is going to continue to increase because Medicare is very adamant about saving money. And we can only predict that, though. It's subject to change at any time. So let's take a look at some positive payment adjustment implications. Here we have Dr. Guy. He scored 50 points in 2017, And then in 2018, he scored 80 points. So this physician is doing quite well. His estimated reimbursement for 2019 is a positive 4%, and for 2020, a positive 5%. Dr. Guy has been practicing, let's say, for 9 years. He's been able to transition fully onto electronic data. He reports as a group. He has 2 physician assistants and 2 nurse practitioners that operate out of his offices, and so they report under one TIN. Dr. Guy usually writes his notes by hand, but then with the help of physician assistants and certified medical scribes, he's able to adequately transcribe his notes into the EHR and capture enough data to report for this exceptional performance. So he received passing scores in both years, and with the extra money he received from his reimbursements, he's able to invest it in expanding his technology, expanding his staff and resources. He also has experienced a boost in patient visits because his ranking on Physician Compare is very high compared to other local docs due to his increased MIPS scores. So this is an example of positive payment adjustment implications. So let's look at the negative payment adjustments. Here we have Dr. Sims. He's also a general practitioner. He operates out of 3 separate private practice locations. He's been in practice for over 15 years. His office has had some trouble implementing an EHR. They feel like it's very challenging to adapt, and they've kept all of their patient records in paper form. Because he's been seeing so many patients for so long, he wasn't able to manually capture all of the quality measures reported, required to report for MIPS. So in 2017, he did not report at all. In 2018, he did a little bit of reporting, but he only earned a score of 15, which did not meet the CMS threshold. So his estimated reimbursement in 2019 was -4, and his 2020 reimbursement was actually 0%. So he stayed with that -4 penalty. So how did he get through to the second year? Dr. Sim and his staff were able to manually put together enough data to submit some of their measures through claims, but since they still haven't been able to switch to the EHR, they received absolutely no points under the advancing care information category, and it was challenging to get accurate quality data. So the score that this provider, Dr. Sim, received was publicly reported onto the Physician Compare website, and as a result, his patient population started to diminish. Patients were seeing his reports and less were going to him, and the drop in clientele impacted his overall revenue in addition to the penalties that he received from CMS. So let's break this down. Let's put actual numbers to these arbitrary percentages and performance scores. So we're going to focus on Dr. Jackie Hall for the rest of the presentation. She's a general practitioner. She sees just over 2,000 patients per year. 45% of her patients are Medicare, so that's about 1,000 patients. And she generates just a little over $650,000 a year, which results in about $300,000 of this total revenue coming directly from Medicare. So the first thing she's going to do is she's going to decide which level of participation she's going to engage in. As we remember from the first part, we've got full, moderate, passing, and non-participation options. In this case, Dr. Jackie is going to adopt a moderate level of passing participation. So for the 2017 and 2018 performance years, she reports 2 quality measures for the full year, and she also reports 2 clinical improvement activities for a 90-day period. This results in the following adjustments. In 2019, she received a positive 3% adjustment, and in 2020, a positive 4% adjustment. And those were received after all of the composite scores came together and she was compared against her physician peers. So if my annual expected revenue for Dr. Jackie was almost $300,000, now in 2019, due to the work that she did in 2017, she's going to be able to add 3% to that. So that's an increase of about $9,000. And in 2020, she's going to add 4%, almost $12,000. So her total annual revenue from 2019 to 2020 increased over time. We can see this general positive curve. This is excellent. She's using that money to reinvest in her office structure, in her technology, etc. As you can see here, these are real numbers, and they can be very impactful, especially for a solo provider. So what happens if Dr. Jackie doesn't adopt any level of participation? So in time to report for 2017, and she doesn't pass in 2018, what would that look like? So in 2017, she does not report on any quality or clinical practice improvement or advancing care information measures. And in 2018, she only reports on the 2 practice improvement measures. And she reports on 1 quality measure. This results in a negative 4% adjustment for 2019 and a negative 3% adjustment in 2020. So let's take a look at the numbers. From her almost $300,000 Medicare revenue, she loses 4% of that in 2019, which is almost $12,000, and she loses almost $9,000 in 2020. So her revenue over time is going to be going down. She does a little bit better in 2020 than she does in 2019, but as we can see, that's a pretty significant hit. And it's something that will continue to be present. MACRA is not going away. So we definitely need to pay close attention to these numbers and put value on reporting successfully for MIPS. So let's do a quick poll. Oh, it looks like my polling session is inactive. So we're going to skip the polls for today, and we're going to jump to any questions. I think I see I might have a few questions. Let me just pull them up here. Give everyone a second to go ahead and enter a question, if they have one, into the text box. It should be at the bottom right of your screen. Okay, great. We have a question about the results. So the question is, we do all this work in 2017 and we don't know about our reimbursement. It doesn't actually affect our reimbursement until 2019. When will we know how we're doing? So the CMS has not quite decided how they're going to disseminate the MIPS performance reports, but they will take the place of your QR/UR, and they will be disseminated in some sort of electronic format sometime during the calendar year 2018. We're hopeful that they will be fairly early in 2018, likely in the spring, that will then you will be able to project how your reimbursement is going to be affected in 2019. Are there any other questions? All right, thank you so much for joining us this afternoon. We hope this was helpful, and we look forward to seeing you for part 3 in a couple of weeks. Happy holidays, everyone.